Oftentimes, during this busy time of year, we get extra tired and stressed out. And some of that is normal, right? But feeling that way all the time is not. I want you to meet Dr. Meghna Thakur. She is with SottoPelle and helps treat patients who suffer from fatigue and weight gain with HRT, or better known as hormone replacement therapy. She's here to explain how it works, and it's so great to have you on Sonoran Living.
Thank you so much for having me. I'm really excited to be here and share about SottoPelle and hormone replacement therapy.
Good, I'm glad, because you know what, we've actually heard about SottoPelle before. There's something very unique about it, but before we talk about what makes it unique, let's talk about HRT and really who's a good candidate for hormone replacement therapy.
Absolutely. So hormone replacement therapy is of course a choice. After a certain age, in men and women, we stop producing enough hormones. Ovaries are the organs that produce hormones in women. They produce estradiol, testosterone, progesterone, and in the mid-30s, the testosterone begins to drop, and further on during menopause, the estrogen and progesterone drop as well. And that's the time when women start feeling not like themselves. They have hot flashes, they feel depressed, their hair starts falling out, the dry skin, weight gain.
Yes.
Yes.
All of these horrible things.
Yes.
And we hear about that a lot as we talk amongst ourselves. Those are some great symptoms, some ideas of symptoms that we can expect. What about men? What do they experience?
Let's not forget the men. For the men also, the lack of energy, lack of libido, they just want to be depressed. They sit on the couch, they don't feel motivated in life. Those are some of the symptoms. Okay,
so you're feeling that way, and a lot of people sitting at home might be nodding and going, yes, that's exactly how I feel. So what happens when they come into SottoPelle? How do you find out where our hormone levels are? What is the best way to do that?
The best way to do it is via a blood test. So when they come in, we check for all their hormone labs. A comprehensive test is done. Okay. And then based on that, based on their symptoms, based on their age, their medical history, we do individualize the treatments.
Okay.
And then based on that, we take the pellets, which are individualized for our patients, and they are placed underneath the skin.
Okay.
It's called, with the minor surgical procedure, it's a little procedure. So it stays in the fat and it's surrounded by blood vessels. So as your heart beats and circulates blood around it, it uses a part of the pellet till it's completely dissolved. So it's used based on your need. Okay. So when you're exercising, when your heart rate is fast, you're using it faster than when you're sleeping at night.
Okay.
That's what makes it unique.
Okay, so some people might use it up a little bit faster than other people, depending on how active you are. And when you say surgical procedure, I want to be clear on that. It's not like this is something like literally that takes 15 minutes or less.
Actually, it just takes 5 minutes. Yeah, it just takes 5 minutes. It's a small little lidocaine shot that numbs up the area, so you feel a mild sting, and that's it. You don't feel anything after that, and it's a very small incision that's made to place the pellets underneath the skin.
Okay, and when will you start to feel like yourself again?
Yes, so within a couple weeks, you'll start feeling a difference, but in 4 to 6 weeks, you really start to feel like yourself.
Wow. And then of course you realize how good you used to feel.
Exactly.
Right? It all kind of comes back to you then.
Right.
So then this is something that we need to do on a regular basis. And do you determine every time we come in the levels of hormones?
So the two things that help me determine when my patients would need them again is based on their blood work and their symptoms.
Okay.
In women it lasts for about 3 to 4 months, and men for 6 months.
Okay. Excellent information. Dr. Thakur, thank you so much
for
joining us here today. And let me give you some information. SottoPelle Therapy, they're located at 8412 East Shea Boulevard. That's Suite 101 in Scottsdale. They also have locations in Paradise Valley, Chandler, and Glendale. Here's how you make your appointment: 480-874-1515. Learn more at SottoPelleTherapy.com.